I've had a lot of patients come to me complaining of insomnia or not being able to sleep. I mean, obviously nobody wants to be reliant on a medication, and the problem with a lot of, at least the prescription sleep aids out there, is that they can be habit forming, and eventually we get to the point where we're taking so much of the sleep aid, or we're taking it so often that we can't go to sleep without it, and that's really the last thing that we want, is for you to not be able to function, without a medication. What we really want to do is encourage lifestyle changes that are sustainable, that are feasible to continue doing without automatically, putting something in our body to cause us to pass out, essentially. A lot of people tend to think, I just need a pill. That's all I need, is I need a pill to fix this. So what I like to emphasize to people is basically sleep hygiene, which sounds very common sense, but a lot of people don't do it, and myself included, because it's difficult. And so part of what good sleep hygiene entails, it's sort of a plethora of things, but part of it is, going to sleep and waking up at the same time, which is difficult because a lot of people tend to like to stay up later on the weekends and sleep in. But it sort of trains your body when you go to bed at the same time and wake up to kind of know when it's time to go to sleep. And now in the digital age, we all have, laptops and iPads and iPhones and everything. And we tend to be on those things, up until the very second we go to sleep. And that's really not good for sleep hygiene. So what I recommend is avoiding any screen time. And that includes, looking at Facebook on your phone or your iPad. So no screen time for an hour prior to going to bed. And then the last thing is not eating right before you go to bed. So your body, needs time to digest, and it's not going to sleep very well if it's trying to digest all the food that you just ate. So avoiding any sort of big meals, at least an hour to 2 hours before you go to bed is important as well.